I understand you're ready whenever we are.
We're ready when you are.
Let's do it.
I'm going to call the Consumer Assistance Advisory Committee meeting of the Silver State Health Insurance Exchange to order. This meeting has been properly noticed. It's 1:30 Thursday, November 15th, and I'd like to welcome it.
Hey, when you are.
I'd like to.
Let's do it.
For those of you that are on the phone, please mute your mic, mute your phones.
Advisory Committee meeting of the Silver State Health Insurance Exchange to order. This meeting has been properly noticed. It's 1:30 Thursday, November 15th, and I'd like to welcome it. Hey, when you are. I'd like to. Let's do it.
For those of you who are on the phone, that feedback is from the web system transmitting, and your mics, your phones need to be muted. I think the feedback loop stopped.
I think tech support's just walked in. I think tech support's just walked in. So, okay. Thank you, everyone, for coming. As Mr. Hager said, if those of you are listening on the phone, if you could please mute your phone, not put it on hold, hold. And with that, Mr. Hager, could you take the roll?
Mr. Downey?
Present.
Miss Ellis?
Here.
Miss Joyner?
Here.
Mr. Mazzoni?
He's not here.
Mr. Mazzoni is absent. Mr. McCoy?
Here.
Miss Periotta Boothman?
She's not here.
Mr. Rodriguez is not here. Vice Chair Lewis?
Here.
And Chair Atkins?
Here.
Madam Chair, we have a quorum with 6 present and 3 absent.
Thank you very much. I do not have any announcements. Mr. Hager, do you have any announcements before we go to public comment?
I do not.
With that, we'll close agenda item 1 and move to public comment. If anybody has public comment, please step forward to the mic. I do not see anybody in Las Vegas. Is there anybody in Carson City?
None here, and we did not get any comments for our web earlier either.
And is there anybody on the telephone who would like to make public comment at this time? I take that as a no, and with that, we'll close agenda item 2 and move on to agenda item 3, approval of the minutes. If everyone's had an opportunity to review the minutes, if there's any changes or corrections, any committee members? If not, if we could get a motion?
Sorry, so moved. Lauren Lewis, for the record, second the motion.
The motion was by Ms. Ellis. All in favor of accepting the minutes, say aye.
Aye.
Aye. Aye. Aye.
Motion carries. With that, agenda item 3 is closed, and we will move to agenda item 4, Mr. Hager.
And for agenda item number 4, you'll notice that there is no written report, and that was simply because we ran out of time. But it is very similar, it would have been very similar to the previous reports that were the review of for the committee. So the last things that are on the calendar to complete, we are working on the appeals process. So today we'll talk about the budget for the appeals and how we want to structure the basic appeals process. We can move into more detail later. Today we're going to talk about something that wasn't on the calendar, and that's whether to allow navigators to assist employers to purchase insurance for their employees on the exchange. We need to provide a detailed consumer assistance program and timeline for completion and present that to the board, and we hope to have that done in the next couple of months for the committee's review, and then prepare a consumer assistance evaluation and monitoring program, and that'll probably be in January, February. One thing I'd like to point out, this committee has worked very hard on the plan for producers, navigators, and brokers, and obviously the information that we provided in agenda item 5A is putting some of that on its head, and we apologize for that. We get new information all the time, and how we can fund various pieces of it has been an ever-evolving process, so we'll get to that more in the next agenda item. That plan was supposed to appear, well, it did appear before the board in October, and we spent quite a bit of time discussing what parts we should review, or what parts of it the board should approve and what parts the board should have us bring back. And then in the end we decided, or the board decided, to defer the entire thing. And when we were coming up with the agenda, my bad for completely forgetting that we deferred the entire thing, so it did not end up appearing on the November board meeting. So that's not to say that it was intentional. It was purely a mistake. However, given the information that we have now about the possible budget for education, outreach, navigation, enrollment functions, we might need to provide an update to that at our next committee meeting. I just wanted to give you guys a background for that. I think that while there has been a lot of back and forth and it's been a very difficult process moving forward, I think the dialogue that we've had at the committee level, at the board level, in the public with all the stakeholders has been very valuable in forming a good enrollment outreach program that's right for Nevada. So while it's been a lot of hard work and we seem to be coming back to some of the same issues, I think in the end it will create a better product. And with that, I'll be happy to answer any questions.
Doesn't look like there's any questions. Thank you very much, Mr. Hager. And for the record, Mr. Mazzoni has arrived. And with that, if we can go to agenda item 5A, Mr. Hager.
So agenda item number 5A is the enrollment assistance budget. And we kind of lump this in together, both navigators and outreach specialists, in the same budget. Part of the discussion that we had at the October meeting was what the budget should be. There was a lot of concern. There has been concern by this committee, and there was a lot of concern by the board. In fact, the board did not want to approve the budget as it was provided. They wanted us to go back and provide a more detailed analysis. And so the result was a report that was given to the board in November, and they wanted to, we provided about 6 different options. They wanted us to fine-tune it a bit and bring it back to this committee, and then have this committee provide a recommendation to the board for December. So what we did, we went through, while the original vision, at least that staff had, and we tried to communicate to the committee and the public, was that much of the navigator enrollment, outreach enrollment process would be leveraging existing resources to help certain communities or community organizations by providing things like upgrades to their computer systems, and in return they would help assist us enroll individuals. Following the discussions with the board, we went back and looked at our total population, what percent of the population we expected to need the assistance of a navigator, the time it would take a navigator to enroll an individual, and then the cost for enrollment to come up with a budget. So the result of that is what you see here in these 7 pages of document. And then we lumped that all into a single budget for a total amount that we needed to include for our enrollment assistance budget, and with a couple of different options. And I think with the Division of Insurance's help, I think we've been able to narrow that down to a single recommendation. So I'll start going through this. First of all, to determine the number of consumers that would seek enrollment assistance, we found a couple of studies. One study indicated that 36% of individuals would seek coverage through a community resource center, and so we equated that to a navigator entity. Another report said 30%, or 3 out of 10. Then 3 out of 10 was a little less specific than the 36%. In that first study that you see on Figure 1, I believe it's 19% were unsure. So when you throw out that 19% that are unsure of the remaining population, 44% of individuals will seek coverage through a community resource center or through a navigator type entity. So we're using that 44%. We're applying that to 142,000 individual enrollees that are currently provided in our budget. If you look at our strategic plan, it's based on 145,000 individuals. 3,000 of those are employees in the shop side. So we're looking specifically at the individual side, the 142,000. We looked at a couple of plans and the average family size. The number of members at 142,000 is made up of not just individuals getting insurance, but also includes the dependents. So, for instance, if you look at the Public Employee Benefits Program, the average family size is about 1.6 or 1.7. So we took a conservative number of 1.3, and so we end up with 109,000 individuals or families that would need assistance through a navigator. When you apply 44% to that, you get 48,000 people that will utilize navigators. And then we utilize a similar functionality to figure out open enrollment 2015, expecting 58,000 people that need navigators. The next section, in the middle of page 3, is the time consumers will spend to enroll. We met with CHIP, Medicaid agencies, producers, and when I say we, I mainly mean that C.J. Bowden, our communications officer, did this. I was hoping he'd be able to provide this report. Unfortunately, we had to set him working on the blueprint, so really wanted him to be here for all this. He deserves the credit for this report. So when you look at it, the agents, CHIP, Medicaid, producers, they were indicating approximately 1 to 2 hours per enrollment. So we went with the conservative 2 hours for each enrollment, and then for each new enrollment. For old enrollments, and this is important for 2015 and later, we said, all right, well, let's bring that down to 1 hour. So we said, of the current enrollees in 2014, let's assume that 90% of them re-enroll and will only require 1 hour to do more shopping and comparing, and hopefully it goes down even further. And then the remaining 10% and all of the new individuals would need 2 hours. So that's how we came up with the hour requirement for each year. So then, to figure out what the budget, the total cost would be, we had to figure out what the hourly rate would be. There are 2 studies, one by Arkansas and one by California. Arkansas used $12 an hour when you add a 35% administrative fee, so our current contract with Kelly Services adds a 35% fee for taxes, for benefits, for all the different administrative requirements for an employee. That goes up to $16.20. In California, based on their enrollments and applications, they were looking at $54,000 a year for a navigator, or $26.20 per hour. That was all inclusive of all benefits and taxes, etc. This is not to say that we intend to pay navigators these amounts. This is simply used as a basis to create the budget for what we expect to need to pay navigators. The actual amount that a navigator will be paid will be up to the entity that gets a navigator grant. It will depend on how they submit their grant application and what their payment rates are. So this is just a basis for the budget. It does not mean that a navigator will be paid these hourly rates. That said, we are not paying, or the committee in the past has indicated that we're not paying per enrollment, we're paying an hourly rate. There will be metrics to make sure that they're doing their job properly and doing the proper work on enrollment. We're not just looking at number of enrollments, we're also looking at quality. There will be surveys to make sure that people are getting unbiased information, and we will be doing some analysis of the various plans to make sure that navigators are statistically in line with other navigators and perhaps brokers, depending on how we look at that data. So we'll try and figure out if there are any outliers. Additionally, we plan to have secret shoppers that will help audit enrollments to make sure that that navigators are performing properly. So again, this is just a way to figure out what the budget would be. Based on all of that information, staff estimates a total need of $2.5 million for enrollment assistance programs in open enrollment 2014 and $1.9 million for enrollment assistance programs during open enrollment 2015. During quarters outside of open enrollments, we're setting aside $20,000 per quarter to provide presentation and outreach and to assist individuals enrolled during special enrollment. So, for instance, if you lose your coverage from your employer, you're terminated, you would be eligible at that point for individual coverage on the exchange. That's a special enrollment for somebody to come on the exchange outside the normal open enrollment period. Navigators and brokers, of course, would be available to assist people enroll during those periods of time. So the concerns that we've had, and we've talked about this quite a bit in the past, and this will kind of go through some of the history of how this has evolved. The Affordable Care Act does not allow any funding of navigators from federal ACA establishment grant funds. And so it's a little confusing when we talk about grants. Navigators are required to be funded through grants from the exchange, but those grants that are paid to navigators are from the operational funds of the exchange, and they either come from an increase in the per member per month fee charged to the carriers or through a reduction of reserves. And I feel very protective of our reserves because of all the unknowns out there. We need to make sure we're solvent, and I don't want to eat into that reserve. I think we have a solid plan to have a 60-day reserve in the first year, and it will gradually bleed down to a 30-day reserve. I think that makes sense. I think all of our stakeholders that have discussed it, I think they believe it makes sense as well. I haven't heard any negative feedback from it. So the only other option then is to raise the rate charged to carriers, and if you raise the rate charged to carriers, that in turn raises the rate that's charged to consumers. So we want to be very cognizant of how much we end up charging the consumer. So when we started this, we originally talked about an assister function, or actually I think there were two tiers of navigators. That got confusing. We provided an assister function because right about that time California came up with their direct benefit assister, but it was sort of a new concept, but it allowed to have a function, a navigator type function outside of the navigator role, and so it could be paid for by ACA grant funds. While that was going on, we were going back and forth with the Division of Insurance and how that would work as far as certification or licensing, and it was all very confusing. You were all confused. We were confused. I think the public was confused. The Division of Insurance, there was lots of confusion going around. So we pulled back from the idea of allowing assisters to enroll, and then when they weren't enrolling, they were only doing outreach, so we called them outreach specialists. A couple of weeks ago, we had a conversation with SOCIO to better understand what was going on, because by that point we had a report from Arkansas, and Arkansas is a partnership exchange. Their entire ACA grant funding is going toward outreach. They are not actually doing the rest of the exchange. It's pretty much all outreach, enrollment, and education. They are not doing the Navigator program. The feds are doing the Navigator program, yet they set aside $4 million for in-person assisters to enroll people in the exchange. And so it got us thinking about it. Well, if they could do it, why can't we? And so you'll see later on, if we do allow this other category of person, whether it's outreach specialists or assisters, they're not really outreach specialists anymore. They're actually enrolling people. So I don't know if outreach specialist is the right name for it. So again, we're kind of turning the whole plan on its head, and I realize that, but bear with me as we get through this. So we asked SOCIO, well, what's the difference between an in-person assister and a navigator? I said, it appears to us that an in-person assister gets funding from the ACA and otherwise does everything else that a navigator does. And they said yes. So then we went back to the Division of Insurance and spoke with them about whether or not it would make sense to be able to have a second category of people that enrolls individuals. And it might be better if the Division of Insurance comes up here, perhaps. What I think that we've agreed on is what I heard from the Division of Insurance is their main concern is consumer protection, and that they will do whatever is necessary to make sure that consumers are protected. And if that means certifying a second category of individual or slightly changing the way the certification is done, they'll do what they need to do. But if I could ask Mr. Plain to speak on behalf of the division, I'd appreciate it.
Certainly. Thank you, Mr. Hager. For the record, Adam Plain, Nevada Division of Insurance. I believe what Mr. Hager has said is correct. In our conversations between the division and the exchange, as this issue has come up with the outreach specialists, assisters, what have you, morphing back into the enrollment function, the division standpoint really is the same as it's been for the last several months. You know, as a consumer protection issue, we want to make sure anyone who enrolls individuals in a health insurance plan on the exchange is properly educated and is accountable for their actions. And if the exchange committee, if the exchange board wants this new category of people or old category of people to perform this function, that is perfectly acceptable. We would maintain again that they are educated and accountable. But if it simplifies your budgetary process, that's an issue that we're perfectly fine with.
And Mr. Plain, they might have questions for you if you could stay right there. So I'm going to finish the report and then ask the committee for questions. So we had basically in this report two options: funding option A and funding option B. In order to get the report out in time, these conversations with the Division of Insurance have been ongoing and even were complete. We had some of these yesterday. So therefore we had two options: funding option A and funding option B, because we now feel that we can allow this second category of individuals to enroll individuals. Then staff recommends funding option A. And basically that allocates the entire increase in the recommended budget that we identified on page 4. The entire increase in that budget would be allocated to the enrollment assistance in the outreach specialist category, and that we're going to relabel that terminology. And while we make a recommendation to relabel it as in-person assister, I'm not sure if that's the best terminology. What I'd like to do is just keep the actual terminology on hold. It might be something like a enrollment facilitator or something like that, but basically the Division of Insurance would certify, let's say, an enrollment assister or enrollment facilitator, and then the exchange will appoint that individual as a navigator pursuant to the Navigator Grant funding requirements, or as an in-person assister or something like that. We would appoint them as two separate entities to break out the funding requirements, and that's simply for funding. After 2014, when the ACA funding goes away, then we can merge the two back together into one entity. We'll probably call them navigators at that point. You can see what the budgetary impact is on page 6. For option A, if you allocate all of that to that second category, the increase in fees is 25 cents per member per month. That increase is because there is an increase to the total operating cost of the exchange, a 60-day reserve. It therefore goes up in cost, and so that increase in 25 cents purely goes to increasing that reserve. Then you see the increases are slightly less over the next couple of years, and in the long term, that the operating cost is fully used or is fully paid for by the exchange, and that's why there's a 26-cent increase per member per month. That's for option A. If we go with option B, which is to put 20% in the outreach specialist category and 80% allocated to navigators, you can see there's a significant increase in 2014. It's much more than it would be in future years for a couple of reasons. Number one, in future years, we expect that the percent of people that will need outreach specialist, navigator type functions will go down significantly from that original 44%. So we've estimated here it was either 25 or 30. I think it was 30%. I can't be sure at this point. But and the other thing is that the entire cost of open enrollment in 2014, which occurs before and after January 1st, 2014, and the entire cost of open enrollment 2015 will also occur in 2014. So that first year has to absorb 2 open enrollments, which is why we have the significant increase in cost in that first year in Figure 4. So with that, I think we have tried to explain the evolution of this process and where we're at now, and I appreciate and thank the committee's indulgence for bearing with us. Be happy to answer any questions.
Thank you, Mr. Hager. Mr. Downey?
Thank you, Madam Chair. Randall Downey for the record. I appreciate the report, and so I guess the congratulations are due to Mr. Bowden. I think the estimates for people approaching the exchange with assistance to enroll are too low, but I think the estimates for time spent per enrollee are dead on. My experience would show that to be the case, that the 2-hour figure is not an unreasonable figure. I was concerned, and I thank you for clearing up, in my mind, at any rate, the disparity between the costs in option B and option A, because I couldn't see where you were getting that excess cost in option B. It appears to me you've chosen in option A the California model, more or less. You're approximating that in terms of funding. Am I correct in that assumption?
Yes, I did not include, right, I think I wrote it, but I didn't say it. So wherever we could, we tried to estimate on the high side. And so when we compared the Arkansas and California payment amounts, we used the California payment amount because it was higher.
Thank you.
And again,
I appreciate
the data that we provided, this was the only data we could find. We scoured the web for quite a while trying to find data. We sent requests to other exchanges and our networking sites, and this is the only data that we had to support any type of budget information.
Thank you. I appreciate that, and I think you've erred in the correct manner, because this will allow a living wage for the navigators as they proceed. I think that's a good thing. I think I would approve of the idea of allowing the outreach specialists, or however their name plays out, to also integrate the role of enrollment in their responsibilities. That's going to be very important, especially in our outlying areas. In practice, I think you're going to see this fall into kind of 3 interwoven groups. You're going to have the navigators who concentrate on enrollment. You're going to have in metro areas, probably my expectation would be you would have the outreach specialists, or whatever their name comes to be, concentrated in the metro areas. But you need that dual coverage, and I think it's going to be critically important for education and enrollment purposes in our rural counties, which make up the bulk of the area here within the state. So I think you're going to see it falling into 3 different categories. They're going to be loosely interwoven with the requirement that those in the outlying regions also have to be certified as navigators. I think you cover the requirements that we need to meet, and I applaud you for that.
Ms. Lewis?
Thank you. Mr. Hager, LaVon Lewis for the record. Am I to understand now that based on recommendation B, funding option B, I believe that it is the feeling of you've gotten information that we can fund with federal dollars the outreach specialist / in-person assister in the role of assisting people to actually enroll in the exchange?
Correct. So the way we laid this report out, because the discussions with the Division of Insurance were ongoing, we provided 2 different options. Option A, we staff elected or recommended to put all of the increase in cost in the outreach specialist, enrollment assister, whatever category you call that one, to allow for the maximization of the use of ACA grant funds. Option B was placed there in case we could not come to a consensus with the Division of Insurance that if the Division of Insurance indicated that state law would not allow for the creation of that second category, we felt it was necessary to make sure that the navigator enrollment assistance budget were appropriately funded, but that we would need to put all of it in the navigator function because navigators are required to facilitate enrollment by federal law, and so the Division of Insurance would allow for a category of navigator because they have indicated that we can provide this additional category. And again, what we think we're going to do, what it appears that the Division of Insurance will do, is create one category. Perhaps it's enrollment facilitator. Enrollment facilitators will get certified. There will be entities that apply for navigator grants that will not be paid for by ACA grants, and that funding will remain for the first year at $380,000. They would apply for grant funds. We'd make sure that we were in compliance with federal law, and they would be required to have on their staff a certified in-person assister, so somebody that has been certified by the Division of Insurance to facilitate enrollment. And then we would, and then the rest of the budget will go to the second category, the in-person assisters, who will also have to be certified to be able to do enrollment. Funding option B was provided there in case we were not afforded that opportunity. At this point, because we feel like we've come to a consensus, staff recommends funding option A.
John, are there any questions from the board right now or from the committee up north?
This is Tom
I have one
McCoy.
question.
Just a comment. This is kind of a sidebar, but it was revealing to me, and it gets back to something we talked about, seems like months ago, and it was, I guess, months ago. Based on these figures, we're looking at 48,000 enrollees. And typical enrollment specialist, navigator, whatever we're calling this person, is going to do 4 a day. Start doing your math. It's going to take a lot of people. And the other aspect of my observation is the fact that Randall brought up about the rurals. It would be helpful, and maybe Division of Insurance, maybe John, your staff has been able to do this, to take a look at pockets of uninsured Nevadans. We may have a significant problem, say in White Pine County, that we don't have somewhere else in terms of how we're going to utilize assets of navigators and specialists and so forth. I'm concerned now, looking at these numbers, that we're going to have the bodies out there to do the job that we're talking about.
So not included in this report, it was edited out, I guess, because it didn't get us to our final resting place, if you will. I believe these numbers indicated that in the 6-month open enrollment period, we would need 106 navigators, 106 individual full-time employees working 8 hours a day, 5 days a week in all of the working days of that 6-month period. Obviously, we would want the enrollment higher, or the incidences of enrollment to occur toward the first half of open enrollment, so they could start their coverage July 1st. So that would mean that you would need even more navigators to meet these requirements. So that's the number of bodies that we're looking at on a full-time basis. If they start doing it on a part-time basis, if this is part of other functions that a group does, then you would obviously need more.
Mr. Mazzoni?
Dwight Mazzoni for the record. John, who are the other individuals that may be doing this job in addition to navigators and enrollment, whatever they are, as a sister thing or beings? What is in other words, if you've done this much work estimating what the navigators are doing, I'm assuming that you've done equally as much work trying to figure out what producers who are duly licensed by the state of Nevada are doing also.
So we've done some work with that. I wouldn't say we've done as much work. If you'll notice on Figure 1 on page 2, I believe it indicates that 24% of the individuals who request assistance from various resources to go to the exchange, 24% would use agents and brokers. Now, these numbers are simply based on a survey that was provided and would not necessarily be representative if there was a concerted effort by the broker community to advertise or to market toward individuals to enroll. Again, this is the only information we have, that 24% of the people that are purchasing individual coverage on the exchange would go to an agent or broker. We did not go through the rest of this exercise because agents and brokers are currently have businesses, are currently working with communities to insure people, and their payment will be done through by the carriers. We will facilitate that payment by providing information to the carriers that indicates a specific broker enrolled an individual or an employer, and so that the carrier would provide the commission to the broker or the payment to the broker as they do today. So we will provide the national producer number to the carrier, but again, the rates of payment to the brokers are based on the specific contracts with the insurers, and so we've not gone into that detail, as we've indicated that we do not plan on regulating or fixing a price for brokers to enroll in the exchange.
John, Lynn Atkins for the record. Is the idea that the in-person assisters will also be block granted?
Yes.
Thank you. Mr. Mazzoni?
So if I understood you correctly, John, Dwight Mazzoni for the record, if I understood you correctly, then of the 140,000 roughly enrollees, is that the correct number?
Yes, it was 142,000 individuals.
Then roughly 23,000 of them will be handled by outside private licensed agents. Would that be a correct assumption? So therefore, the figures that are being used are slightly skewed when you think that, or when you're stating that that everybody's going to be handled by navigators and other people. I think we need to take a little better look, and if we can do this much work to figure out what the navigators are doing, I think we really ought to be looking at what the licensed agents should be doing here too, because we are supposedly an integral part of this process.
For the record, John Hager, yes, so 24% of the 142,000 would be, based on this survey, would be enrolled by agents or brokers, by producers. So
Mr. Hager, it's 18%. It's 18%, not the 24% is the in customer service.
I'm sorry, 18%.
It's the 18%.
So roughly 20% of 140,000 is what, 28,000 people would go to an agent or broker. I would welcome the opportunity by agents and brokers to assist more individuals, and we do plan on providing more outreach to the broker and agent community. We had to get past this step to get there. I'm not sure exactly what additional work you would like us to do, Mr. Mazzoni, since we're coming up with a budget and brokers are paid for by the carriers. This was simply to create a budget for the navigators and outreach specialists or in-person assisters. But I'd be happy to provide any information to this committee that it requests.
I would humbly submit, sir, that respectfully submit that the cost, whether using an agent or whether using a navigator, should be fairly equivalent to each other. Number one. Number two, in past discussions that we've had within this group, it is my understanding that a navigator and a producer should respectively have education processes similar to be able to sell the product somehow through in the exchange, so that the people that are on both sides of this fence, if you will, I don't want it to be a fence, are equally educated, equally compensated, or at least within respect to ACA and PPAC as to how the monies have to flow and where the grants come from, so that we don't have a lot of dispute between, quote, the two sides of this equation, being the private licensed producer and the navigator.
If I might chime in, Lynn Atkins for the record, I think maybe there's some confusion. The funding and the budget that this committee and the board is trying to figure out is the funding for the navigators, in-person assisters, and outreach specialists. The brokers and the producers, I think, as Mr. Hager was talking about, will continue to be paid in the same manner that they are being paid. And so we do not have to figure out a budget for that. That is not part of our that is not part of our budget. That's outside contracts that the brokers and producers have with the different insurance companies. Is that right, Mr. Hager?
Yes, Madam Chair. I think what Mr. Mazzoni might be getting at is the concern that navigators be properly certified and trained by the Division of Insurance, and so on that side, the Division of Insurance has committed to making sure that consumers are protected with the appropriate training and certification. I'm getting nods, so that's good. I'm good. So then the other part of that is if we are concerned about compensation, and maybe I'm incorrect, but basically this provides, if you're talking $26, let's just make it easy, $25 per hour for the navigator type entity. If it takes them 2 hours, they're going to get compensated $50 for an enrollment. I'm not sure what the average broker fee is, but my understanding is it's $30 per month, and obviously the brokers provide additional services. So I don't know if we should increase the navigator budget based on that. I'm concerned at some point we need to be cognizant of the cost. I guess that's it.
Actually, that's not really I understand that, and I think we have done a commendable job of trying to put this educational piece. What I'm talking about is, at least my understanding, is that the fees that there are fees going to be charged the insurance companies. Somebody has to pay those fees. It's the consumer, and I'm a little concerned that everybody kind of seems to feel like, well, it doesn't matter because the insurance agents get paid by the insurance company. There's a direct relationship between what you're going to be taking away from the insurance companies in the way of a fee to operate in the state for a product, and a commission that's going to be paid. So next thing I know, for my people that I have to deal with is, we now have already had our commissions cut 50% once. So here goes the next round of cuts. Why are we getting cut? Because we have to give money to the consumers. So you're taking money away from me, an agent, and giving it to somebody out there who's educated as per our discussion and agreement and everything else. And I'm not sure that there's an equity factor in this thing that we're looking at when it comes to there's only so many dollars out there, unless you're going to jump those rates up 25, 30, and as we've heard from some companies, as high as in 2014, individual and consumers are going to be paying between 10 and 60% more premium, in part due to what's being charged through the exchange in order to support the exchange and the navigators that are involved. That's my concern, is we're really playing in a very, very treacherous minefield of the funds that are available to pay insurance companies. I don't care where they come from, even the federal government. But certainly any impact on premiums, any impact on charged consumer, no matter where money's come from, is going to be felt across the board, from me all the way through you as the exchange and the navigators and everybody else. I mean, there's only so many dollars in this pot. I'm sorry, but I can't quite see the balance of funds working out the way it's easily described when all you talk about is one side of the equation. There is no one side of this equation. It's a whole equation, and it needs to include every single dollar that is going into the equation and where the money goes and who are you going to affect when the money comes out of the equation.
My mind completely went blank. Mr. Downey, I'm sorry.
Okay. Thank you. If I may ask for a clarification, I appreciate Mr. Mazzoni's concerns, and I think it's been partially answered by Madam Chair and by you, Director Hager, but we're looking at the estimates you've given us in figure number 1. If I'm reading it right and understand it correctly, that was based on the historical experience of the program in Washington State, in large part?
That was based on a survey, probably in Washington State. I can't remember. No, the second report was Washington State. This was a survey that was done by the Health Research Institute. I'm not sure if it was state-specific.
Okay, but we're building the budget, and the figures you've provided us based on this survey, and I think it adequately or accurately reflects the experience of consumers as to who they approach to assist them, if they approach anyone at all, in their in enrollment into health coverage. And I don't know if that helps answer your question, Mr. Mazzoni, but I think this reflects a real consideration and a real historical experience on the part of consumers as to who they go to. And it could be, and I think you're absolutely right, you raised the point of fact that the insurance industry could engage in an aggressive marketing campaign to encourage consumers to approach them. And we have to wait to see how that plays out, and that may alleviate the concerns you've raised.
Ms. Ellis?
TV Ellis for the record. I just want to make a comment to proceed cautiously with the number calculations, because 24% plan to purchase online services through the Insurance Exchange customer service, and as we know, a great majority of the uninsured in Nevada, it's formed by the minority population, which may or may not know how to approach these online services. So I just wanted to give you a word of caution not to underestimate that 24%, a big chunk of those may end up seeking health insurance through the other options, whether it is through producers, navigators, or assisters. Okay? Thank you.
Are there any other comments, Mr. Mazzoni?
I want to clarify. This is not a producer versus navigator argument. If you think that, put it out of your mind. This is a dollar argument. Show me where the dollars are coming from within the system. The system is built by insurance companies to provide a product to the exchange. It's simply a dollar equation. You can't exclude any monies paid to a navigator and come up with an equation that works any more than you can exclude any monies paid to a broker and have it work. It has to all of the monies that are going to be in this system have to be accounted for, and to exclude anybody is doing a disservice to the product that we're trying to create. That's really what I'm trying to get down to. And so I truly believe that I think you've done a commendable job, John. I really have. I mean, everybody's put a lot of effort and work in here. But if we don't bring in all of the dollars that are going to be expended someplace in this, whether it be producer compensation, whether it be the navigator compensation, whether it be how you run your office, if we don't have a really good hard look at every single dollar that's included in here, then someplace along the line, someone is going to get their toe stubbed, and it's going to be pretty damn bad. And there's going to be a lot of issues that are going to come up either from your side of the fence, the company side of the fence, by raising rates so high that nobody can buy the product, or by a producer having their commissions cut. Our commissions get cut anymore. Maybe this is what everybody wants. Cut the commissions. Hell, the insurance agent will be out of the equation. I don't think that's totally true, but certainly that has been discussion that's been had in circles that I travel in. So I'm really concerned that we are only looking at only looking at the exchange side of the equation and not adding in a factor for the compensation for anybody else out there that might have to play in this field.
Ms. Lewis?
Madam Chair, Lavon Lewis for the record. And I certainly understand Mr. Mazzoni's concerns, and I realize that he is talking about our looking at the whole picture. I think, though, that and maybe that's something that needs to go to the Finance and Sustainability Committee for further review, possibly. But I think for our purposes here, we are really looking at the consumer and how we serve the consumer of our products, and how do we provide them the opportunity to enroll in the exchange. And I don't think that we can look at that whole, that really it is within our purview to do that, to look at that whole picture as being described by Mr. Mazzoni.
Thank you. If there's no more comments, can I get a motion on option A?
So moved. TV Ellis for the record. Oh, is there a motion? TV Ellis for the record. In taking a look at all the information provided, and thank you to the staff and Mr. Hager, what we're looking at on item number 5A is for a recommendation to the staff to continue to finish up the budget request. So I'd like to propose the consideration of the re-evaluation, I guess, or renaming of both the roles and name as deemed necessary, including the additional training provided by the Department of Insurance. And with that in mind, then suggest or make a motion to approve budget option A.
Is there a second?
Lavon Lewis for the record. I second the motion.
Any discussion? All those in favor of the motion? Can we have a rereading of the motion? Is the motion to ask staff to prepare a budget on option A?
Yes, Madam Chair. TV Ellis.
And is that the second?
Yes, Madam Chair. Lavon Lewis.
Thank you. Any other discussion? All in favor say aye.
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 All opposed? The motion carries. With that, if we can move to agenda item B, 5B.
For the record, John Hager. Agenda item number 5B, the impetus for this report was we received reports or heard that some states, and I don't remember which ones, but some states were precluding navigators from enrolling employers in the shop exchange. And as we got to thinking about it, there are a lot of services that producers provide to employers now that that navigators will not be able to provide. And it's not that they couldn't partner with people, I suppose, but then the lines start getting fuzzy as far as funding and the conflict of interest requirements. But basically, producers provide not only health insurance to employers, but also a number of other services. And if it's not that producer that provides that service, they have partnerships, or they know exactly who to call to get that service for an employer. Some of these services include life insurance, accidental death and dismemberment, property and casualty insurance, health savings accounts, health reimbursement arrangements, and flexible spending accounts, 401k or pension administration, COBRA administration, voluntary products such as auto, homeowners, and rental insurance, perhaps workman's comp. There's a lot of different services, again, that it's outside of the navigator purview. The navigator needs to enroll individuals in health insurance on the exchange. That's not to say that navigators shouldn't have knowledge of other services that are provided. For instance, navigators need to understand the basics on Medicaid and welfare. if somebody has a question about one of these products, they should be able to, if not refer them to a specific producer, but at least know on the know where a list of producers is. So with that, the staff's recommendation is to preclude navigators from facilitating the enrollment of employers in the shop exchange. The recommendation written here was employers and employees. There has been concern that regarding whether or not a producer, once they've signed up an employer, how much they actually assist the employee, and so maybe Mr. Mazzoni can assist us on that. So certainly, I think staff's recommendation is to preclude navigators from facilitating the enrollment of employers, and we welcome any discussion about whether the navigator should preclude enrollment for employees in the shop exchange.
Ms. Ellis?
TV Ellis for the record. In looking at the report provided by the staff on page 2, it says that the information provided in several studies, and it lists a study by the Insurance Illinois State done by one of their consultant firms. And in that study, I actually printed the study. The study was made just to assist the state of Illinois in implementing their health insurance exchange. And in those pages, in nowhere, I found an indication that they were suggesting to preclude navigators from enrolling in the exchange. They did, however, highlight the models for the implementation of the exchange, as we did hear from our own consultants back in November, as early as August last year. In Section 2, they also provided a recommendation on the different type of premiums and the options of the premiums for the exchange. And in Section number 3, they provided consideration for the funding of those producers in the exchange in Illinois, which we already have made those decisions here in Nevada. So I didn't find in this report, I find that reference a little misleading because it did not provide a recommendation to preclude navigators. But furthermore, I went ahead and looked at our own report back in August 3rd, 2011, which highlighted several key issues that were important for us as we move forward in the implementation of the exchange. It did say that over 70% of the uninsured not only are U.S. citizens, but 50% of those are employed. It also highlighted, and I make reference to page 7, it said that despite of making roughly 27% of the population in Nevada, Hispanics and other minorities make the majority of the percentage of the uninsured in the state. And I'm going somewhere with this. I furthermore printed a report, which is a study made by a survey of business owners, which is part of census.gov econ report from 2007, which highlights the contribution of business owners from the Hispanic community, especially in Nevada. And in that report, nationwide, it says that in 2007, there were almost 250,000 Hispanic business owners firmed who were employers. However, there were over 2 million business owner firms that were of Hispanic origins who were not employers, were probably using subcontractors, or they were self-employed or small business owners, less than 25% or less than 50%, less than 50 employees, I'm sorry. I looked further at a graph, and I'm happy to give this to Madam Chair so that she can have these data. I looked at a graph that includes Nevada share of the business owners in the state by heritage, and Hispanic share 44 to 85% of business owners in Nevada. Mexican business owners go high to 50 to 100% of some areas of business owners in the state. So but based on that report, and further when I looked into the same report from August 3rd, 2011, on tables that provided information about 250,000 working uninsured in Nevada, it says that 84% are employed by private sector firms, most of them are small businesses, and 11% of those are self-employed. A further analysis also identified that 26.5% of the uninsured are employed in the arts, entertainment, recreation, accommodation, food services industry, which is a big bulk of the Clark County population, which the majority of the uninsured are located too. And in the last page, on one of the graphs on page 19, it talks about 50% of the state uninsured reports to be on some kind of employee capability or situation. What this raises is the question on the original suggestion for a recommendation. While I understand that the role of producers with business owners goes beyond the enrollment of health insurance, the list provided here of the additional service like life insurance, accidental property, health, savings accounts, 401k, COBRA, and all of those, that's an additional portfolio of services the producers provide that are not related to health insurance that they can continue to provide. But what we're talking about here, particularly in this committee and on the insurance exchange, is health insurance. And I see no reason why there should be a preclusion of one of the community providers or one of the classifications that have been defined as being capable and furthermore will be trained, licensed, and certified and funded to provide these services to business owners that may be below the mark of the 25 or more employees. So I think it's a really broad blanket on the recommendation to preclude navigators from facilitating enrollment of employees. My question is, which employees, how big of employee, what number of employees, employers, and employees. As we know, a lot of these uninsured in Nevada are currently employees, so precluding navigators is precluding them to do the job that you are setting them to be and certifying them and paying them to do. Thank you.
Mr. Mazzoni?
Dwight Mazzoni, for the record. With all due respect, while I understand your commentary, there are many agents who do not deal with these things and hand them off. I do not handle property and casualty insurance. I have several other agents from various ethnic backgrounds and walks of life that handle property casualty. I am not a pension man. That takes and sometimes a whole another series of licenses. I am not a COBRA administrator. That takes a whole different degree of liability issues, knowledge and information, and the COBRA administration arena in this market is ever changing, sometimes virtually daily or weekly. Voluntary products, for the most part, most agents some agents can handle, but your list is very short. By the way, Mr. Hager, we need to expand it for voluntary products because many of the producers you're talking about, at least on the individual side of it, we do not handle auto, homeowners, or rental insurance. Again, that's handled by a totally different property and casualty agent, who I would suggest that if you wanted to include property and casualty agents into navigators and producers, then we're going so far beyond ACA and PPACA when it comes to navigators and the SHOP program that we're creating brand new law on top of federal law if we were to try to do it in the state. Working in the small group environment in these days, and I don't know what it'll look like when the SHOP programs come out, but the small group environment sometimes takes as long as 3, 4, 5, even 6 months to get through everything with the owner. There's been a change, hopefully spreading fairly rapidly, that allows the employees to have more insight and more involvement in the decision to pick a product that fits their needs. Sometimes it's the product that the owner's wife or the owner's husband likes the best. Sometimes it's what the owner likes or who he plays golf with. There's so many factors. For a navigator, in my mind, based upon our discussions, you better give me about 2.5 years with the navigator to sit down and start going through all this, because I've been in this business 40 years. I don't handle even half of this list that's on this report. and I don't want to handle it. It's a pain. It takes me away from what I do at best, which is I do health insurance. I think the recommendation in this report should be followed. If in the future it can be changed because of a difference in what's going on, then fine, let's take a look at it. But right now, I don't want to eat the elephant whole. I just want to eat it one bite at a time, and this is the whole damn elephant.
Madam Chair, if I might, just to be clear for the committee, this report is not intended to say that navigators or producers are required to provide all of these functions. The concern was that an employer will go to a navigator to satisfy their insurance needs, and the navigator will be able to, or in-person assister or whatever we call them, will be able to provide assistance in purchasing health insurance, but not be able to provide any of these other services. As Mr. Mazzoni pointed out, he only does part of these services and has partners that do some of the other services. We do not intend to provide these services on the exchange, though we might end up providing health savings accounts, health reimbursement arrangements, potentially, depending on the plans that are offered and the partnerships that are formed. COBRA administration should not be on this list. It's an oversight. The exchange will provide COBRA administration for SHOP participants who are terminated from their employees. But the rest of this list, and we are well aware of the laws and regulations, what this was meant to provide a list of services that employers often choose from or may choose from that the navigator would not be able to provide, that producers are, while that producer may not provide it, they are currently set up to provide services or have the partnerships or have the connections to be able to quickly provide those services. Certainly, we could determine that a navigator could just as easily refer somebody to a producer that has those specialties. Although I will say that if we provide a list of producers on our website, however we provide that list, it will be of health insurance producers, not of these other types of producers. With that, I'll be happy to take any questions.
Madam Chair?
Yes, Mr. McCoy.
Just a comment on this discussion. I think that we all understand the role of the navigator and the purpose of having cultural and linguistically appropriate folks involved. And I think this applies based on the information that we just heard. One of our committee members regarding, for example, Hispanic population and small business operators. There's going to be small business operators that are going to be getting involved in insurance for the very first time, for themselves as well as for their employees. They've got some considerations that they have to make. I personally don't really, it's not a question about caring, but I don't think it's even something that we need to be talking about in terms of these other services, because the purpose of the Affordable Care Act is to get people insured. And in the case of Nevada, where we have the nation's highest uninsured rate, this is our goal. And so for that reason, I think that there's no, I see no logic in saying a navigator couldn't help a SHOP situation. I don't think that a majority of them are going to be involved in that process. But if there are some organizations that can reach out to, for example, Hispanic businesses and assist them in a way that a provider possibly could, but they're going to be more comfortable working with that particular group that has a enrollment specialist or whatever we're calling them. I see no reason why we wouldn't have that option. I think it makes a lot of sense as we find ourselves from a business standpoint in Nevada in 2012.
Mr. Mazzoni.
Tom, I totally concur with you, and this has nothing to do with anybody's race, color, creed, or whether they're a navigator or anything else. It's just a pure matter of actuality of the marketplace. One of my concerns, or one of the issues I would ask, and John, if you can answer this briefly, I guess. Therefore, if I am a licensed property and casualty agency with no life or health license, could I become a navigator?
I'm not sure.
I think we're down here thinking that if somebody goes through the training and certification, that person could do that. I guess it would depend maybe if they're compensated.
It would depend on their compensation, I think.
Yeah.
And Mr. Plain might have something to add from the Division of Insurance.
For the record, Adam Plain, Nevada Division of Insurance. Mr. Mazzoni, to address your question, that was actually a concern that the division brought to Health and Human Services and Center for Consumer Information and Insurance Oversight several months ago. The regulations in the Federal Register stipulate that a navigator cannot receive compensation from health insurance issuer for their duties, more or less. And we had brought the concern that, well, in an insurer holding company environment, a health insurer may be a related entity to a property casualty insurer, and a producer may have relationships with both companies, and there may be some opportunity for ill-gotten gains or illicit transactions through related companies. When that was brought to the federal government's attention, the impression I got was that was a scenario they had not considered. It was something that would seem to be fairly new to them, and we have not actually received a response since then. There are supposed to be regulations and rules printed soon. I'm hoping that maybe some of these state-based questions would be addressed in those, although I wouldn't put money on it unless you gave me very good odds. But it's an issue that we've asked, and without further federal guidance, I don't know that the state is, any state agency is really in a position to definitively answer one way or the other yet.
Mr. Downey.
Thank you, Madam Chair. Randall Downey for the record. I feel I must concur in the remarks made by Committee Member McCoy and Ms. Ellis as well. I think any attempt, my expectation is that most employers who currently insure will maintain a relationship with their brokers. Many others who do not currently insure will approach brokers through the business network. However, in the minority community and in rural communities, I think that, especially in the minority communities, they're going to be looking towards culturally appropriate agencies to assist them. And I think especially, well, one, in the minority community here in Nevada, which is growing by leaps and bounds, but also taking into consideration those of our fellow citizens who live in the outlying rural areas. I think any attempt to limit the number of individuals, navigators, or producers who can assist these individuals obtain coverage for their employees is a bad move. So I would argue against this proposal on those grounds.
Madam Chair,
Do any other committee members have any questions or comments?
Madam Chair, Amber Joyner for the record. I'd just like to chime in and concur that I would not be in favor of this proposal to exclude them. I can, excuse me, I can picture several scenarios where, especially in the rural areas of our state, a navigator would be giving a presentation and come into contact with some of these small employers, and I would hate to have them not be able to offer advice, especially if I, for example, as a small employer, am able to go online and enroll my employees by myself. I would hope that if I just had a couple of questions and I know the navigator in town, that they could assist me with those couple of questions without having to create a whole new relationship with the producer. I think this goes back to our argument all along where part of the navigator training will just have to be where they know when they're out of their depth and they'll have to know when to refer people. And I think part of their training maybe should be that when it deals with a small employer, tell them up front what your limitations are, that you have more limitations than maybe dealing with individuals. But to definitely, I wouldn't want a navigator to get in trouble for offering not offering advice, offering information to a small employer. So.
Ms. Lewis?
I have nothing to add other than to say I concur with most of it.
It sounds like it sounds like to me that the committee is in favor of making a motion that the navigators be allowed to facilitate enrollment of employers and employees in the shop exchange. Understanding that's not going to be a unanimous decision, but that is what I'm hearing, I believe, from every committee member. So if that is correct, if I could get a motion.
T.B. Ellis, for the record, a motion that navigators are included in facilitating enrollment of employees and employees into the shop exchange.
I second that motion.
Any discussion? All in favor?
Aye.
Aye.
Aye. All opposed?
For the record, Dwight Mazzoni, against.
Thank you. The motion carries. Break. If we can take a break, about a 5-minute break, that would be great.
Committee, I believe, asked for a more in-depth staffing plan for the Exchange call center. We requested that Xerox State Healthcare LLC, our vendor for the call center, provide that report, and the result is what you see here. So I have with us Bill DeLange from Xerox, and he will be able to provide a brief presentation and answer any questions that the committee might have. Mr. DeLange.
Good afternoon, and thank you. Again, for the record, Bill DeLange with Xerox. From what Mr. Hager suggested, we did produce a report regarding staffing, and I won't go into great detail here. If you have any questions, please feel free to ask. But we did highlight a few areas that I wanted to point out in regards to numbers, staffing, training in our facility. Number one is our recruitment efforts. We're working with the State of Nevada, the Job Connect, once we get to that point of hiring certain individuals for our operations in Las Vegas. To promote our positions, we're working with several recruiters within the Xerox Corporation, as well as other entities around the state of Nevada to fulfill those staffing positions once they become posted. Once we hire somebody within the scope of our agreement and the numbers that you see here, we have an extensive staffing plan, a training plan. We also have a workforce management plan, and we can go into great details or if any questions come up about those as well. Based on the numbers that we have, we certainly understand the concern from the past couple of months, the committee regarding numbers and open enrollment, the influx of calls that we may receive. The numbers that you see here is based on the assumptions from the numbers that we receive from the exchange. However, during the first open enrollment period, we do have a contingency plan regarding extra staffing from other contracts, temporary staffing, pulling other resources within our own contract, as well as other contracts that could help us out. Again, part of this presentation, there's a lot of training that goes involved with this. We certainly understand when we hire a new employee, it's just not taking a certain call or maybe upsizing somebody's request, but we certainly understand the sensitivity regarding our members that call into our call center. So that's something that is certainly during our hiring process. The sensitivity, it's personal, it's confidential, and it's also building that relationship as well with that member to feel that comfortable, the no wrong door approach. One thing I do want to point out is one thing we've been looking at least from a call center perspective, and a lot of terms you might hear and read, is contact center. We certainly understand a call center environment is calls. However, we have the capability of answering emails, web chat. There's, of course, with social media now, there's many different avenues that we may receive requests that come in. That's one thing about our staffing plan that we're really looking at how many calls can one individual handle, how many emails can another individual handle, web chat, things like that. The previous call center that I've built myself, I've had several people maybe having several web chats at once. So you might have 2 or 3 conversations going on in lieu of certain calls might not come in. Maybe there's not a huge influx of calls. They can handle more emails. So that's something our workforce manager is really going to look at to determine the staffing levels, agent utilization, where we can move them from one category, say emails, correspondence, to helping us out on the calls. And any questions at this time?
Lynn Atkins, I do have a couple of questions. If the committee doesn't mind if I start. Thank you for preparing the report. I know both the committee and the has been questioning, I guess, the capacity of the call center to make sure that people do not have a bad experience. And I am certainly not an expert in any of these staffing numbers, but as I've said, we've brought, I think, to staff's attention our very serious concern that the worst thing that could happen is, the first week we just aren't prepared for the onslaught of calls and requests for help and requests for people to sign up that we hope is going to happen, but we hope we have the capacity to staff it. So at some point, we'll be satisfied with what you're proposing because you guys are the experts and should be able to help, should be able to really be able to tell us what you need. So thank you for preparing this. That being said, I'm still not thrilled with the call center hours. I just don't see how we can do from 8 to 6 Monday through Friday open enrollment, and I do see there's a Saturday from 9 to 1, but I just, with this 24-hour town, that just does not seem sensitive to a lot of people who might need to access and talk to somebody on the phone. So that's probably the one thing that still sticks out to me that doesn't look right.
Madam Chair, for the record, John Hager. We discussed this specifically, the call center hours during the negotiations with Xerox. Their concern when we talked about it was that typically after these hours, the utilization was extremely low and the cost was excessive compared to the utilization. So the contract was designed with these hours. If we need to negotiate the contract, we certainly could. We'd be up for a recommendation from the committee and the board to do that.
A follow-up question: the use of these after hours is low where in Nevada?
I didn't get the details on where that might be, so it might be different here in Nevada. I think that Choice Administrators typically mostly operates in California. Do you have a presence in Nevada? Yeah, does Choice? I don't think Choice has a presence in Nevada. So perhaps Los Angeles and San Francisco might be a more apples-to-apples comparison, but not for Nevada specifically.
Mr. Downey.
Thank you, Madam Chair. Randall Downey for the record. Are these numbers in terms of staffing? My experience as a counselor navigator with the Medicare program was the calls came in. We could not answer them immediately. Many came in overnight, and we would have call sheets to begin the following day. Is it assumed that most calls are handled immediately as they come in? That's my question number one. For the gentleman from Xerox.
Yes, Bill DeLang for the record. Thank you for your question. That is correct. That's the first line of defense, if you will, or the first response is our call center representatives will be capable to handle or triage that call, if you will. If it's something that needs more research, they would certainly hand it off to a different tier, and that's something that we're building right now. Any calls that come in maybe after hours or emails, that would be handled according to our workforce management schedule.
Okay. That raises the question in my mind then, because that lowers the productivity of your staff, of your your customer care specialist, because the majority of wasted time, if you will, and I wouldn't necessarily, I don't like that word, but time spent is returning calls to individuals who previously called in seeking assistance. And then you play a phone tag menu throughout the morning or the afternoon or the day attempting to reach them. And that dramatically lowers your productivity in terms of being able to assist a family or an individual. So I would echo Ms. Etkin's concerns given the time allotted for the operation of the call center for that specific reason.
Ms. Ellis?
TV Ellis, for the record. I have a question. Of those 32 care specialists during the call center hours, which is 5 days, 10 hours, and an additional Saturday for additional hours, how many will they be any particular time on site per schedule? So there's not 38 all the time because you need to do schedules and people take days off and you have full-time positions and perhaps some part-time. So is there any indication of how many would you have on site at any given time on those schedules?
Again, Bill DeLange for the record. Thank you for the question. At this time, we do not, and the only reason I say that is we're still working with the exchange based on how many calls we anticipate will come in per day, and that's something our workforce manager person will forecast. It's something that we'll need to adjust as we go along during open enrollment.
Thank you. Am I understanding this graph correctly on page 6? Average minutes for application or renewal and eligibility questions called, so that would be kind of average time for an enrollment of a person. You're planning for 10 minutes because the exchange is planning for an hour, 2 hours face-to-face. What would that be different over the phone?
This right here, to my understanding, would be more just questions about an enrollment, maybe a little bit more in depth, maybe not a full enrollment.
Well, according to item 5A in our agenda, Mr. Hager, 24% of people out there, according to that survey, will seek insurance, health insurance through the exchange to the customer service representative of the exchange, which is Xerox. So that 24% represent about 40 people a day on those 6 months of enrollment period for the first year at an hour a day. So I'm trying to put numbers here together, how many people we're going to have for about an hour, 2 hour average, 40 people a day, according to these 24%. If it is by Xerox, anticipation is 27.5% of the people that will be calling the center to enroll.
For the record, John Hager. So the previous report was a survey done by another entity that indicated that 24% would seek assistance through the call center. Xerox indicated in this report, a separate report, that it would be 27.5% based on their experience with, I believe, with CalChoice. To me, that's a pretty close number, so we can utilize the 27.5%. The issue, of course, that you're bringing up is how long each call will take and how many calls there will be per enrollee. Again, as Mr. DeLange stated, this is the average headcount throughout the year. There is certainly a lot of flexibility built into what I've seen of their call center to allow for the additional calling staff or call center staff from those that are at home, from other groups, other contracts. They have I believe, 1,000-person call center in Las Vegas that currently works with a client or several clients. And my understanding, Mr. DeLange, is you indicated that you'd be able to pull in some from a contract such as that or other contracts throughout the U.S.?
That is correct.
So, yes, we are deeply concerned. The staff is concerned that the staffing levels are appropriate. We are working continuously with Xerox to make sure that we appropriately staff the call center to make sure that we don't lose enrollees. The other thing that we have in our contract, our service level agreements, there Xerox is required to answer calls, I believe, within 30 seconds. They can only have, I think it's a 2 or 3, maybe probably 3% abandonment rate, pretty much standard industry requirements. And so if they are not meeting those requirements, they will need to increase their staffing levels to make sure that they meet those requirements. My understanding of the current operations is they are very flexible and have been flexible in the past to be able to absorb those extra requirements.
Lynn Atkins, for the record. That brings up a point, though, and I would love if there is maybe a better, more complete answer. If somebody does call and say, I want to enroll, will you enroll me? I don't have access to a website, or I don't want to do it on the website. I'm assuming it's going to take more than the 10 minutes. Do we think it's going to take an hour? Do we think it's going to take 40 minutes? I mean, is there a sense of how long it's going to take somebody to enroll when they call?
I think our original estimates from the previous report, an hour to 2 hours, is appropriate. That has been our experience with the exchange that the state launched for its Medicare retirees, and I think Xerox is prepared for those enrollment times.
Ms. Ellis?
2 hours, TBL is for the record, 2 hours multiplied by 40 people average is anywhere between 24 and 27% people anticipated to enroll through the customer service. It's about 40 people a day. 2 hours, that's 80 hours a day. So I'm just putting this out there. I don't think that we are aware of the amount of time that this may actually take. And are we staffing properly? Thank you.
Ms. Lewis?
Just adding on to what Ms. Ellis has said, if we are talking about 24% of the people, we're talking anywhere between around 28,000 folks that would be expected to enroll through, through this mechanism, or even if we're talking half that many, I think that we need to rethink the 10-minute amount of time that has been indicated here for renewal or application renewal and eligibility question calls.
I don't think there's a motion of any sort pending. I think this was a report to the committee, which we appreciate greatly, and we know staff appreciate, so everyone can keep taking a look at this to make sure we're covering our bases. Mr. McCoy or Ms. Joyner, do you have any final questions before we move on?
Yeah, just a comment. We've talked in the past about concerns, and they've already been expressed, staffing concerns. People say, I'm not an expert. I have mentioned before, I have 2 experts in my family. I have a daughter that trains insurance call center personnel. And my wife was in not of insurance, but airline call center for 20 years. They both liked this report, by the way, Bill. I turned it over. I said, what do you think? They said, it's a great report except the staffing. And that's been my concern, and my expert wives are always experts. She agrees with me, and the whole 24-hour day. I really think initially, if we say to Nevadans who are uninsured, and we do a good job of marketing, and I know we're going to have a vendor that takes care of that, they're going to be calling, and they want to get on now. They've got a window but they want to get on now. I don't think you're going to have the staffing as structured now to take care of it. I will make one suggestion, and I've done this in another life, and that has to do with perhaps utilizing alphabetical blocks in terms of calls. If your name is between A and M, Monday, whatever. A lot of places do that when they have an early rush of interest. But I think the worst thing in the world will be to have people that have been anticipating the opportunity, then have a call wait time that tells them hang up, because everybody's working on an hour to 2 hours to get somebody enrolled, Bill, and I'm there and I'm saying, oh, the heck with this. Now, I may at that point go see Mr. Mazzone, but it is just, that's the bother for me is the staffing. I just don't think it's adequate.
This is Amber for the record. I guess I don't know if you want to take a motion or not, but this is the second or third time that we've seen this range of times. And I very much hope that the next time we see this report or the next time this goes to the board, that it could go with a recommendation from this committee if we all agree that these definitely need to be changed, in my opinion. I mean, in my life, there's no way that between 8 a.m. and 6 p.m. I could take personal time to sit down to figure out my family's health insurance. So, I mean, I would definitely like to see these increased, if not 24 hours, at least till 10 p.m., midnight, and then also Sunday. I mean, that's when a lot of people get their personal life business done. So that would just be my suggestion.
I think it's a good suggestion. Mr. Hager, do you want to chime in on kind of the discussion, or if you think we need to bring something to the board, if we need a motion, or if staff hears us?
For the record, John Hager, I think it would be appropriate for staff to go back with Xerox and get a more refined report surrounding open enrollment to satisfy the committee's concern regarding the staffing levels. As far as the call center hours go, those are specifically in the contract. I don't know at this point whether or not an increase in those hours would cause an increase in the cost of the contract. If it does cause an increase in the cost of the contract, we would need to do a contract amendment and take that to the Board of Examiners for approval by the Board of Examiners. And I would feel more comfortable doing that if the board were to approve that request. I don't know if we could make a recommendation on this. Is our DAG there?
Yes.
Could the committee make a recommendation today for the board to amend the contract to change the hours based on this report? Actually, I think
yes. She says the item says it's for possible action.
Okay.
Ms. Joyner, would you like to make a motion?
Thank you. I'm Joyner for the record. I don't know if you need specific hours or not, but I guess my recommendation would be to reconsider the hours, to extend the hours that are in the contract, to include Sunday hours. Do we want to say 24 hours and see how much that would cost and then work down from there? I mean, we have a lot of casino workers that would be trying to get on at 2 a.m., I think, but I'm not sure what motion would be how specific you'd like it.
Mr. Hager, what would be helpful if we gave specific hours, or if we said, during open enrollment, Monday through Friday, 8 to midnight, and offer Sunday hours, or would it be easier just to have a motion that said just expand the hours to include evenings and Sundays?
I think a motion to expand the hours to include evenings and Sundays would be sufficient.
Amber Joyner for the record. I'd like to make the motion to include evenings and Sundays.
I second it.
Any discussion? All in favor say aye.
Aye.
Aye. All opposed? Motion carries. Thank you very much. That was great. Agenda item 7. Mr. Hager.
Just a moment.
While you're kind of working or writing some notes, Mr. Hager, I just wanted to make a comment, if I can, that I know we had some discussion about the producers and their role and with the budgets and everything, and I wanted everyone to know that at the last board meeting, which was, I think, last week, there's constantly discussion about how to get the producers involved and to make sure that they are continuing to be a part of the healthcare exchange, and to make sure that anyone who is interested in going to a producer or a broker has that capability. I think the board knows very well that we need everybody to participate in this endeavor to make it successful. So we continue to think of ways to include producers, whether it be at outreach events or as I think Mr. Hager suggested, there might be the names on the website or whatever it is, so we can have as many people as possible enrolling people. So I just wanted to make that comment.
For the record, John Hager, agenda item number 7 is in regards to consumer complaints and appeals, and the report provides information regarding the types of appeals the exchange might encounter, a proposed hearing process, the required budget for an in-house operation of exchange appeals, and the potential option of contracting out the appeals function of the exchange. To be clear, regulations do not require that that exchanges handle appeals. However, given that there will likely be plenty of implementation issues, not to say that I don't have faith in our partners with Xerox and our ability to make the appropriate rules and regulations, but it's implementation, and things are going to happen, and people are going to appeal the eligibility or enrollment decision. It's inevitable. So I think it is incumbent upon the exchange to create an appeals process. So we looked at various programs. The Division of Welfare and Supportive Services has an appeals process where all of their appeals are handled through the centralized hearing representative team, or I guess it's pronounced CHART. They deal with an average of 500 appeals per month. Of those, 30% or 150 per month on average are Medicaid eligibility appeals. So with 150 Medicaid appeals per month at 1,800 appeals per year, with a population of 330,000 Medicaid individuals, that's an appeals rate of approximately 0.54%. So 0.54% of appeals of individuals enrolled in Medicaid appeal each year. To handle that caseload, CHART has a supervisor, 7 pre-hearing officers, and an administrative assistant. The 9-member team effectively handles the appeals from initial receipt to the handoff with the hearings officer. They handle all 500 appeals per month. There's a 90-day appeal window. If the client does not appeal the decision within that time frame, the appeal becomes invalid. Appeals for all categories except SNAP must be submitted in writing to the welfare office. Appeals are logged and immediately forwarded within 10 days to CHART. Once CHART receives the appeal, it's assigned to a pre-hearing officer who reviews the appeal for validity, confirms the facts. If the facts substantiate the caseworker's decision, the pre-hearing officer issues a second notice of decision and closes the case. If the pre-hearing officer finds errors in the work done by the department, the case is sent back to welfare caseworker to restart the process. If the client disagrees with the finding in B, the pre-hearing officer will prepare a packet to present on behalf of the agency to a hearing officer and the administrative adjudications team. The administrative adjudications team has 2 hearing officers, 2 administrative assistants, and a chief who spends 10 to 15% of his time working on the hearing process. The hearing officers schedule and conduct all hearings in the following manner. The agency presents its case, the client presents the client's case, and often they have legal representation. The agency responds to the client's case, the hearing officer closes the hearing and deliberates over the information, and the hearing officer renders a final written decision. The hearing officer will stand as final. The hearing officer's decision will stand as final or may be appealed yet again to district court. The administrative adjudications team consists of approximately 12 to 15 hearings per month, or 3% of appeals. Of the 140 to 160 hearings conducted each year, approximately 3% are appealed to district court. We have asked the Center for Consumer Information and Insurance Oversight whether the appeals or hearings for the exchange can be appealed to a court, to federal court, district court, what have you. We haven't gotten an answer on that yet. But with that, then we also looked at the Medicare D national rollout appeals data. and for Medicare Part D, which was part of the Medicare Modernization Act of 2003 and became effective, I believe it was in 2005, there were some 24 million participants enrolled in Medicare Part D. I believe there were 1.5 million complaints. Now, a complaint does not necessarily mean appeal. A complaint can be a problem with a specific issue. An appeal is where you are trying to reverse the determination of an entity. So that doesn't mean that all of those are appeals, but some of them are. So that's a 6.56 complaint rate in the implementation period. So based on that, we could expect to field as many as 9,500 complaints in the first year and 12,000 complaints in the second year, although we expect the number to be closer in the second year to 5,000 due to a lower rate of complaints once you get into a process once it's been implemented. These figures would include all complaints and grievances as well as appeals, so the number of appeals would be much lower. Based on a 3% hearing rate, the exchange could expect to send between 23 and 285 appeals to a hearing in 2014 and between 30 and 360 appeals to a hearing in 2015. The reason for the high numbers is based on the I believe it's a 6.56% complaint rate. What we've done for this report is quadrupled the welfare or the Medicaid appeals rate because of the implementation of this project, and we've assumed an appeals rate of 2.16%. The BOSS contract requirement for complaints and appeals are laid out. The complaints on page 7, appeals through page 8. But basically, Xerox will handle the initial appeals. So they'll have caseworkers that will be, or call center representatives. When they get something that the individual feels is incorrect, it will be appealed to an in-house appeals department. If the person still feels that the appeal was not handled properly, or that the case was not handled properly, it would go to a hearings officer, and our recommendation is it goes to a hearing officer that is outside of Xerox with a state entity, whether that's the exchange or with a contracted agency, and we'll get to that decision process here in a second. So you can see the formal appeals process that Xerox has. The workflow is laid out on page 11. They record calls, they'll have the written material, and they'll provide all of their information on the reason why the caseworker indicated that the enrollment was denied, or whatever the issue was. The person would appeal it, and the appeals worker at Xerox would look at the case in much the same manner that welfare and Medicaid would look at it. Again, once the individual got through that process and determined, you know what, that's not doing it for me, I don't agree with it still, they would go to the hearing option. And so we have two options for the committee to consider. Option A is to establish an in-house hearing department, and we looked at including a hearing officer and an administrative assistant. The total cost is for two positions is about $150,000 a year. Based on the number of appeals, it appears that the number of appeals would each appeal would cost $1,600 in 2014 and would go down to about $1,100 in 2016 per appeal. And that is simply based on the total salaries divided by the number of appeals. Now, that's not to say that in the off time when they're not doing that, we would probably have these hearing officers do something different. And that said, however, we reached out to various agencies. There are a lot of different agencies that handle appeals. Obviously, welfare has a hearing or hearings. Welfare has a hearings division. I believe the Department of Employment Training and Rehabilitation has a hearings division. And we looked at the Department of Administration. In one of the board meetings, Director Mullenkamp indicated that they have appeals or hearing officers that would be more than capable of absorbing the exchange's hearings. They, in fact, absorb all of the overload for all of the other agencies, so they do a multiple types of appeals. They have offices both in Carson City and Las Vegas, and the stats are provided on page 13. They have indicated that the average billing is approximately $200 per appeal, as you can see, significantly less than it would be to have it in-house. The department's annual report that provides the detailed information regarding agency performance can be viewed at the link on page 14. So the recommendation from staff is to define the scope of authority that will be given to the Customer Service Center appeals specialist to resolve appeals before they are escalated directly to Exchange staff, and recommend to the board to either establish an in-house hearing department within the Exchange or contract with the Department of Administration Hearings Division for hearing officer services.
Thank you, Mr. Hager. Any questions, comments from the board, from the committee?
That's quite all right, Madam Chair.
Mr. Downey, I don't know what my problem is today. I'm so sorry. I'm just, yes, I apologize. Mr. Downey.
Thank you. Randall Downey for the record. I just had a couple questions. We're discussing here appeals regarding only eligibility and or I'm assuming also the subsidy, whether denial of Medicaid coverage or questions regarding premium tax assistance. But it's primarily eligibility is the subject of the appeal matters we're concerned with here. Am I correct?
For the record, John Hager, close. You are correct. It's primarily eligibility and enrollment appeals. It would not be Medicaid or CHIP appeals. Welfare and Medicaid would adjudicate those appeals for Medicaid and welfare. The advanced premium tax credit, there are determinations that are done on an automated basis, but they are not really appeals. The process for the APTC eligibility, basically, you put your information online or through the paper process or over the phone. You give the call center income information. It's sent off to the eligibility engine, to the federal data hub. If it's within a certain percentage, then it says, yep, you're right. And based on that information, your APTC is X. If that's not the case, if it says we can't confirm this is different, then the individual will have to provide supporting documentation that shows that their income matches what they have indicated. And then your APTC is based on that information. If that APTC is incorrect, that would be reconciled at the end of the tax year by the individual. So primarily it's eligibility and enrollment in the exchange.
Thank you. So what we're considering here is an appeals process basically covering only eligibility, denial of, or acceptance into. So we're not discussing denials of service, excess charges by plans, and the like.
So there shouldn't be any excess.
We're not creating an appeals process to deal with those issues currently.
Correct.
Thank you.
I don't see any other questions down here. Are there any questions up in Carson City from committee members?
Yes, please. Madam Chair, Tom McCoy. Let me see if I've got this. I go to a navigator and I get enrolled, and I've got some questions about eligibility or whatever. Then I'm going to the Xerox system.
When you go to a navigator to enroll, the information that the navigator receives from you will either be put in a paper application or more efficiently directly into the website with the navigator. So you will always be going through the Xerox solution at some point.
Okay, well, what I'm getting at, John, is the handoff. Again, focusing in on the clientele that a lot of navigators will be dealing with, there's a relationship that's either, precedes their involvement with insurance or becomes because of their involvement with insurance. I think the natural reaction is going to be, oh, I got a problem. Can you help me? And of course, they're not in a position to help. So what I'm getting at is it may be confusing, and it's going to take, I think, some good training to make sure that navigators are fully aware and they make the individual fully aware of the appeals process and how there's a telephone number that they have to call, that sort of thing.
Absolutely. Couldn't agree more.
The other, just a comment I want to make, as we get to the recommendation, my recommendation is this is in-house. And this becomes a very specialized, even though it's just eligibility, as some people might want to consider it. I see that there's a thread that runs through the Silver State Health Insurance Exchange, and I would hate to see that the appeal end of it is removed and thrown to some other agency.
Mr. Mazzoni, there's somebody on the phone. If you can please put it on mute. Mr. Mazzoni.
Dwight Mazzoni for the record. I'd suggest, along with what Tom just said, that for navigators, producers, enablers, entitlers, and all the other bodies that we have hanging around, and John's staff and the committees that are still left, or the board that are still left, that we actually have a packet that's prepared that would not only go through what Tom was just talking about, but I'd strongly recommend that in there that if it's a eligibility issue that's not eligibility issue.
Thank you for calling Washoe Legal Services. Please listen carefully as our extension numbers have changed. If you know your party's extension, you may enter it at any time during this message. To utilize our spell by name directory, please press 3 now, or to leave a message in our general mailbox,
for those
which will
of you
be
who can
answered
still
promptly,
hear me over the phone,
please press 1 now.
Please continue to
reach
watch
an
on the
operator,
website.
please
We have to
press
turn
0.
the phone off
Thank
so
you
that we
again
don't get
for
the
calling.
hold.
Are we back on, John?
Please continue, sir.
Thank you. I would recommend that we create an actual policies and procedures handbook, file, whatever you want to call it. It could be put on a disk or printed or whatever, make it readily and easily available, downloadable if possible, that would give directions to myself or Randall Downey or whoever is the person that is interacting with the client, the customer, the insured person, that will address all of the possible things we can think of with a number, a telephone number, an email address, a website, whatever could be necessary, so that, and I realize that we're running into a technological problem with some of the clients, I understand that, but this way we would have, somebody could have access, or the people that are interacting with the client would have access or information that would be up to date, current, for them to either direct the client, to help the client if they needed to go with them, or even hand them the whole book and say, here, you want questions, here's all the information. And I don't think it needs to be too big or too bulky. It probably 1, maybe 2 pages at the most by the time we get through with it, brief to the point. If you have a problem with billing, John, where do I go? And just call this phone number or talk to this person or whatever. I think if we can nip this in the bud to get it to the people that are going to be interacting with the client, that will be a huge help and possibly stop a lot of involvement on a call-in, or at least give someone some place to go. Just my recommendation. Thank you, sir.
Ms. Ellis?
TV Ellis for the record. I have a question, John, maybe, Mr. Hager, maybe you can help me. The recommendation the staff is looking for is for a decision of establishing the hearing either in-house or at an existing state agency. In the graph, and when we're talking hearing, are we talking about the whole appealing process? Because on page 7 I have numbers that divide estimated appeals and estimated hearings. So are we including all of these processes on the option of whether to do it in-house or contract it out? Second, in the workflow, where will the hearing process begin? And if I see that the Health Insurance Exchange through our partner with Xerox will handle some of these appeal process. These two options, whether keep it inside or in-house or subcontract it out, how will these flow change? Can you help me understand a little better? Because I'm confused between the appeal and the hearing, and are we doing all in one, or are we separating these functions?
For the record, John Hager, they are separated functions. Our current contract with Xerox State Healthcare LLC requires that Xerox handle initial tier of appeals. So you'll have your customer call center representative. They're going to help enroll somebody. They're going to take the initial complaints and issues. If it is an appeal, they will hand it off to an appeals unit that will handle the appeal and make a determination similar to how the chart team does it with welfare. If the person still feels that the appeal was that they are correct, at that point it would go to a hearing that would be handled by a state entity. So in the flow diagram on page 11, you can see the bottom box where it says appeal routed to state entity. So at that point, you would have your hearings officer hear those appeals that were that the individual wanted to continue to pursue in much the same way that the administrative adjudications team does with welfare. That that group would be either an in-house hearing officer that would, again, the cost would be approximately over $1,000 per appeal, or it would be outsourced to the Department of Administration that already has expertise in place to handle appeals and can do it at a relatively low cost.
Ms. Lewis?
LaVon Lewis for the record. We are, well, is the assumption, or is the, maybe not an assumption, is it a fact that Xerox would be handling all appeals, even where the determination had been made by a navigator or somebody else in the process?
For the record, John Hager. So for a navigator, in Mr. McCoy's scenario where the individual is being helped by a navigator, the navigator sees a problem and they go to the call center. The navigator will attempt to resolve it with the call center, and I don't foresee that requiring an appeals team. That is a navigator acting on behalf of the individual to get the issue fixed. And very often it really should not go, if Xerox handles the enrollment properly, it should not go to appeal. That said, we're handling this appeals process, we're creating this appeals process in case it's not handled properly. So if the caseworker says, you know what, you're right, navigator, we need to fix that, they fix it and off it goes. If the caseworker at the call center says, no, this is what the determination has been, at that point it would go to the appeal. And Mr. Mazzoni is absolutely correct. We need to have a manual or a page document, a quick look, something that tells individuals where to go, navigators where to go, brokers where to go, individuals, employers, etc. We are working on all of those types of things in our requirements and configuration sessions with Xerox. We actually just finished the first set of 3. And so the next one I think is in January, and there's another one in March. And when I say one, I mean it's a set of probably 20 day-long meetings that staff attends with Xerox to make sure we have the proper requirements, the business requirements set. So we've been working very intensely with Xerox to make sure they have the requirements. We are starting to move into the phase, as I said, we finished the Rack A, we're going into Rack B, which is going to start doing some of the nitty-gritty on the specific requirements, the materials that have to be sent out, and the quick look. So the navigator would have the information that they need to first call the call center and try to get it fixed at that level. If the call center still says at that point that nope, the information or the determination of Xerox stands, at that point it would go to an appeal. And so any determination that Xerox makes, the Xerox call center would make, the Xerox Appeals Center would handle all the appeals, and then if at that point the individual still felt that it was incorrect, at that point it would go to a hearing with the state entity.
Lynn Atkins, for the record, I have a comment. I agree with Mr. McCoy that we want to maintain as much control over the entire process from beginning to end, including the appeals, but I'm not sure how I feel about not trying to leverage another state agency to assist us with that process if they are currently set up to do that. I'm not sure where I am on that. So I don't know, just felt like needing to say that. Mr. Downey?
Thank you, Madam Chair. Randall Downey for the record. Along those lines, you identified the Hearings Division as a possible, under the Department of Administration, as a possible division to handle the appeals. Was any thought given or has a discussion been had with the Consumer Health Assistance Office? They currently handle Medicare appeals, for example, and they do intervene in Medicaid as well, as a possible other state agency which might provide that service.
I can't recall if we contacted GovChaw. I think there should be representative there. Is there a representative from GovChaw there? But my understanding is that they don't, and I could be incorrect on this, but that they don't have hearing officers, that they handle appeals. But once it gets beyond the appeal to a hearing, they don't necessarily have hearing officers. I could be wrong on that. Is a representative from GovChaw at your meeting there?
No.
Oh. Okay, so we will get back to the committee on whether or not GovChaw has hearing officers, but I don't think that they have hearing officers.
Madam Chair?
Yes, Ms. Joyner?
Amber Joyner for the record. Although I do agree with Mr. McCoy generally that we want as much control in-house as possible, I actually see an advantage both financially and from a customer service perspective in sending this out of house. And the reason for that is I think that I, as a consumer, if I feel wronged by the exchange, there are so few of these cases that are going to be escalated. It looks like about 8 a month, if that's a correct number. If I feel wronged by the exchange, I think as a customer I might like it that an objective state agency were to look at my case. And so I actually think that's a positive thing. And then financially, I think it's very clear. You're looking at $200 versus over $1,000 per case. And I think in a previous meeting we talked about how we weren't sure if we were to hire these 2 new staff people, really what the capacity would be. You know, if we ended up with way more than that, scaling up would be much more difficult, I think, than just contracting out more cases to the Department of Administration. So I'd actually be in favor of outsourcing this particular function.
Ms. Lewis?
I just have one question on the dollar amounts that are shown in the 2 graphs, and I'm not sure I understand the $95,910 for a hearing officer that's shown in, well, I guess that's really still part of option A. Okay. Forget it. No dollar amount in option B. Thank you.
Our representative from GovChaw's back, or here, and she's walking up to the table. I think the question, did you hear the question? I think the question was whether or not your agency would be capable of handling appeals from the exchange?
Hearings.
I mean doing the hearings.
Hi, this is Paulette Gramiak from GovChaw. No, we don't handle hearings in our office. We do appeals for insurance companies, for the external reviews that are mandated, but we do not do hearings in our office.
Thank you, Mr. Mazzoni.
If I understood Randall correctly, I believe the question was more if there is a hearing going on with any constituent that you might deal with at the state level, are you accessed to give testimony or assistance or guidance at a what did you call it? I don't remember what the name. What do you call it? A senior moment? We both had senior moments. But does your office go beyond, not to hold a hearing, but are you there to provide testimony, input, or guidance to either the client or to the entity that's holding the hearing if it's about a health care or a GovChaw issue?
Yes, we do that. If we get a complaint from a consumer who has had a denied benefit currently from their insurance company, what we do is we will review it with them. We can write the appeal. We don't represent them at a hearing, but we do guide them through the process.
If I may, Madam Chair. Question then, are you barred by specific statute or regulation from serving that function as a hearing officer?
You know what, Randall, I'm not aware if we are. I know that I've been with the agency for a little over 9 years, and we have never actually gone to a hearing with somebody. We will prepare the documentation and walk them through the process, but currently we do not attend the hearing. Am I answering your question?
In part. My question was a little distinct from that. You currently may serve as a hearing advocate. My question is, we were discussing outsourcing hearings on appeals from the exchange on eligibility, for example, to a state agency, and it was brought up that the Department of Administration Hearing Division might be an appropriate agency to hear those appeals on eligibility. My thought was the Consumer Health Assistance Program, since its primary function is to deal with health coverage and health insurance issues, might be a more appropriate division if you have the authority to act as a hearings office. And I don't know whether you are specifically barred from exercising that power or that authority. I guess that's a question, Mr. Hager, to be pursued. I don't expect you, Paulette, to know the NRS or the statutes.
For the record, John Hager, I can answer that in a different manner. I don't know about the statutes and whether or not they have the ability to do hearings. However, to conduct hearings, they have to have hearing officers, which have to be specifically provided for in their budget, and it's not provided in their budget. The concern that I would have about providing to have GovChaw do the hearings is that they do not currently do hearings, and so they would have to become experts on hearings in the same manner that the exchange would have to. So if we're going to require that GovChaw do hearings, a function that they currently don't do, for the number of hearings that we have, the cost would be just as high for them as it would be for the exchange to do it. In that case, I would say, why not do it in-house? One of the reasons why you might be able to tell from my tone of the presentation that I would favor letting the Department of Administration do the hearings is because, number one, they have the expertise to do hearings, and it's not simply a matter of expertise in a specific area such as health insurance. It's more of expertise in hearings themselves and administrative law and how that works. They know how to do that right now. So if we were to do that in-house or at GovChaw, we would have to not only staff up but train up individuals that could do hearings and create a whole new set of procedures. If we let the Department of Administration do it, number one, they do it for multiple sources and are able to absorb the small numbers of appeals that we have. They're set up to do it already, and it's a lot less expensive than it would be if we were to do it or if we were to request that GovChaw did it. And again, if you were to request that GovChaw did it, it would have to be done in a budget amendment through the legislative process, which isn't a sure thing.
Thank you, Mr. Hager. I know that Mr. Hager needs to leave at 4 o'clock, so I want to try and get through this agenda item by then, which gives us about 10 minutes. It sounds like we've had some discussion, at least on recommendation 2 under item 7, and I don't know if someone's prepared to make a motion on that item, and then we can leave the remaining time to talk about recommendation 1. So is there a motion on item 2?
So moved, Dwight Mazzoni, for the record.
Which one?
So moved what? Item 2. It's either to, we either need the motion to contract out with the division with another agency, such as the Department of Administration, or do it in-house, the appeals.
Contract out.
Is there a second?
Madam Chairman, Levon Lewis, second the motion.
Any discussion? All in favor say aye.
Aye.
Aye. All opposed?
Yeah, no.
Okay, Mr. McCoy is nay for the record, and that motion is carried. So discussion on recommendation 1. Mr. Hager, I think it sounds like there's already a contract in place with Xerox about what their duties and responsibilities for complaints and appeals are supposed to be. So I'm trying to get a sense of what what you need or want from us, or if any recommendation from us might alter a contract.
For the record, John Hager. So it appeared from previous discussions with this committee that perhaps there was a requirement by the committee or the board to only allow Xerox to administer certain types of appeals. Again, based on the contract, the appeals that Xerox is required to administer are all appeals regarding their functions, and so the process that we laid out, we feel very comfortable, is an appropriate process. So perhaps just an affirmation from the committee that that we will handle all appeals through Xerox, the Xerox appeals team, and then those individuals who feel that it's still not right would take it to a hearing in the process that we just approved.
May I ask a couple of questions on that? I know, so this is going to, starting on page 7 then, correct? So it's basically all of the items from page 7 to page 10.
Yes.
It's the 13 items. I guess I have one comment, which is, I think, is the continuing comment that we've said in all of our meetings, which is staffing and time it's going to take, and using this same amount of staff that the Xerox company just presented to us that we're all continually concerned about. So I think the staffing issue. And then I do remember at our last committee meeting, and it might have been Mr. McCoy who had brought this up, but what I don't want to have happen is people have to continually go back and forth to Xerox, and I think giving them kind of one shot to fix something, and then getting it to exchange staff, and so that's kind of, I'm just again worried about capacity and worrying about kind of Xerox being continually asked to fix problems. Ms. Ellis? Go ahead, Mr. Hager.
So we will bring back the staffing, appeals staffing, with the new and improved appeal, or new and improved staffing plan that we talked about at the previous item. As far as the process, we intend to make it as streamlined and as appropriate as possible. That process is currently under development and won't be available for the board or committee for several months to come. Now, it's going to take some time to go through all of the requirements. We actually have to think about all of the different scenarios, and there's hundreds of different scenarios that could come up to be able to determine what the appropriate appeals process is. So we're working on that. I think that's one of the subjects of the next set of RAC sessions, and hopefully the committee will have something to review probably about the March timeframe.
Madam Chair.
Ms. Ellis?
Just one observation.
Mr. McCoy, go ahead, and then Ms. Ellis can go after.
Oh, I'm sorry. This is real quick, and this is just a matter of typographical, for the record. Beginning on page 7, the reference to solution as a lowercase, I think you really either use BOS or use solution with a capital S. It's a little confusing as to what you're talking about there.
Ms. Ellis?
TV Ellis for the record. So I guess for the next meeting, we're going to be looking at different or more expanded option of the staffing level for Xerox, but I also want to I'm going back and forth between the reports from Xerox presentation and now looking at the numbers at 250 appeals per month. They'll come out at approximately 13 appeals per day. And my understanding of the appeal process, and please help me out or correct me if I'm wrong, it does take substantial amount of time of researching and going back and forth and providing some quality service in order to resolve those appeals. So I just want to put that forward as we look forward to seeing a renew or a revised staffing level from Xerox.
Lynn Atkins for the record. I'm wondering if item recommendation 1 should be brought back when we see the staffing, because I think it's just so tied in. I don't know, Mr. Hager, could we, for purposes of what you need to move forward, can we defer this one part of item 7 to the next meeting when we review, or whenever it is that we do review the staffing?
We could, if the committee determines then that it doesn't want Xerox to do certain types of appeals, then we would have to build that into our budget, and it might become too late to do that. We're working against some tight deadlines, and I realize we're getting to this late. It's difficult to get everything before the committees in the appropriate times. However, I don't think that the staffing levels should be I don't think we should dictate what the appeals are by the staffing levels. The staffing levels should be dictated by what we expect the appeals levels to be. So I think it's probably more appropriate to say, yes, we agree Xerox should do all the appeals just like it's in their contract, and you better come up with good staffing levels. Or, you know what, there is some kind of appeal, and I don't know what that might be. Perhaps the committee has some experience in it, but there might be some type of appeal that we don't think Xerox should handle. And that's kind of what we were looking at. Again, staff is comfortable with having Xerox manage all appeals, and then once they are still determined by the individual to be inappropriate, they would go to the hearing level. And then it's at that point where the hearing officer could uphold or overturn the appeal.
Thank you. With that, are there any other questions from the committee? Well, what would the committee like to do?
Madam Chair, Levon Lewis, I think that if we have identified from page 7 on the responsibilities of Xerox and the scope of authority that they will be given in terms of the customer service center appeals, then we can just recommend approval of that particular scope of authority, assuming, well, maybe not assuming, but certainly operating under the premise that there will be a sufficient number of customer service specialists to be able to handle these appeals. So that would be my recommendation. I move what I said earlier.
I would second that as framed.
We have a motion on the floor that's been moved and seconded. Is there any discussion? Can the record show that Mr. Mazzoni is out of the room? All those in favor say aye.
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 Aye. All opposed, nay. The motion carries. We got a lot done today. I'm really, really thankful. Agenda item 8. Mr. Hager, we have a committee meeting scheduled for 2 weeks. Are we going to keep that date, or are we going to vacate that date?
I suppose that's up to this committee. However, we just talked about completely upending the outreach specialist and changing it and making different requirements of it. So I think it would probably be appropriate for the committee to once again review the plan for navigators, producers, and whatever they're called, to make sure that we have an appropriate plan to present to the board in December. With that, we will include the updated budget numbers. We will update the budget numbers to include the changes that indicate that navigators will assist in the same proportions shop enrollees. And we'll include basically all of the stuff that we discussed here today, other than the appeals, will be in that report for the committee to review.
Thank you. So we will see everybody in 2 weeks. Agenda item 8 is closed. We're at public comment. Is there any public comment in Las Vegas? It does not look like there is. I know the phones have been disconnected. Is there any public comment up in Carson City?
None here.
Does not look like it. So with that, we will adjourn the meeting. Thank you, everyone, for all of your time, and have a wonderful Thanksgiving, and we'll see you in 2 weeks. Thank you.